There you go. I don't know if you heard that or not, but I did. And so we're recording this session, this 1 hour free webinar hosted by Prevention Plus Wellness, located here in beautiful St. Augustine and historic St. Augustine, Florida. My name is Dr. Chudley Birch, and I am the CEO and founder at Prevention Plus Wellness, LLC. And just to let you know, the forecast today, 56 and cloudy and sort of rainy and windy here in St. Augustine. Not the typical weather for us, but it's a nice change. I hope it's nice where you're at. I hope you're all safe and healthy, and thank you for joining us. And thanks for all that you do for children and families in your region. God bless you guys. So we're going to have an hour today. If you have any questions, if you have any comments, if something's not clear, if you want to share anything about what you're doing as a prevention specialist, a health professional, a fitness and sports person, a coach, a parent, whatever, you are welcome to do so on the chat space or Q&A space. And then we'll get to those comments and those questions at the end of today's session. So we've got this topic of an evidence-based model, which is designed to integrate substance use prevention along with the promotion of protective wellness behaviors, sports, physical activity, healthy breakfast and fruits and vegetable consumption and other nutrition, sleep, stress control, etc. So that's what we're talking about. I'm going to provide you with an evidence-based model that you can use. We'll talk about evidence-based programs, and we'll talk about the need for all of this. And in fact, let's go ahead and take a look at the objectives for today. So number one, you'll be able to identify why youth and young adults should receive interventions that both prevent substance use and at the same time promote sports, physical activities, and other health promoting behaviors. That's number one. Very, very important. And I can't tell you enough about how important that is. And I hope I'll make that case today for you. And by the way, I'll be sending everybody who's registered a PDF of these slides, which you are welcome to share with others throughout your region, state, nation, to get the word out. Because that number one, that first item, so critical for everyone to know, parents and professionals, those who work with youth at all or young adults at all, that we really need to be addressing more broadly the health risks that young people are facing, not just substance use, but these chronic disease risks, not just chronic disease risks, but substance use, all of these things, looking at this problem from a holistic perspective and addressing more down the lines of positive youth development or a broader holistic strategy for improving physical and mental health of youth. All right, you can tell it's going to be windy. This is going to be a lot of content for me today because I'm excited about it. Number two, we're going to review the evidence-based programs. There are a few evidence-based programs already in existence that you could use, take them right off the shelf and use them, that address substance use prevention and at the same time promote physical activity and healthy behaviors of young people. Number three, I'm sorry, but I was looking out my window as people were walking by. Number three, explore a three-step evidence-based model. This is the model that you can use as teachers, clinicians, coaches, whatever, parents, and develop your own brief communications that link for your youth, avoiding substance use and promoting and engaging in sports and physical activities and healthy nutrition, et cetera. And I'm going to give you that model, and you'll be able to use that model on your own to create your own messaging and strategy. So let's go ahead and dive right into it. What's the problem? The problem is multiple health risks among today's adolescents and young adults. So for those of you that are in the substance use and mental health prevention areas, I'm sure you're very, very familiar with this. This is the most recent youth risk behavior survey data, all high school students, a sample of all high school adolescents throughout the country. That's the US country we're talking about. This is the percentage of ever using each of these substances. And the most recent data, 2019, although for some reason that question about ever using alcohol was not on the 2019 survey, it was on a 2017 survey. So that's why we have a little bit of older data for the alcohol measure. So we do know, and this is probably the case even today, that the most prevalent substance abuse among adolescents and young adults is alcohol. 6 out of 10 have tried alcohol. Over half have tried vaping e-cigarettes. Over a third have used marijuana. A quarter have used cigarettes. 14+% have used opioids for non-medical reasons. So this is the layout. These are the risks, some of the risks with regard to substance use. Of course, there are other substances of use and other addictions, but we're just, this is a snapshot of this. And you can see multiple risks in the substance use and addiction area. Now, for those of you that work in prevention, you may not be as familiar with this information, and that is that young people, and again, same data set, youth risk behavior survey data, most recent data 2019, chronic disease risks. These are risks that will, over time, increase the chances, the likelihood that young people as they age will experience chronic diseases like diabetes, obesity, heart disease, stroke, osteoporosis, et cetera. And we can see, looking at the very top of the list, is the percentage of behaviors. 3 out of 4 adolescents, high school adolescents in the United States are getting less than 8 hours of sleep. 8 hours they need, some need 9, some need 10. And so really our kids, 3/4 of them, only a quarter, are getting 8 hours or more of sleep. It's amazing. It's just sort of staggering, actually, in my opinion. Going down the list, you can see that 42% of youth are having less than 1 fruit and vegetable a day. They should be having 2 and 3 servings, 5 total, roughly, fruits and vegetables. And there was even a survey came out recently, just within the last week, on adult consumption of fruits and vegetables. I think 10% were eating the required amount of fruits and vegetables. So we're a nation of not eating fruits and vegetables, which are absolutely essential for young people for their development, physical, mental development, but also their functioning. The fruits and vegetables, they're a miracle, actually. They're a pill that have nutrients in them that are essential to growth and functioning. And our kids aren't getting the required amount, nowhere near it. Only a third have eaten breakfast among high school adolescents in the United States. And we don't even know of those third if that's a healthy breakfast. In other words, whether it's balanced and you had, 3 or 4 different types of different servings of food within that breakfast meal. So we've got 2/3 not eating breakfast, believe it or not. We've got not even a fourth getting the amount of physical activity required every day. That's an hour minimum physical activity, ages, I think, 6 or 8, all the way to 18. That's according to Centers for Disease Control Prevention and other health and fitness organizations. So young people, physically inactive, not eating breakfast, not getting adequate sleep. And you can see that last item, 46+% spending 3 or more hours on video games, too much television, too much screen time, in other words. So those are some of the risks. There was a great study of high school adolescents throughout the country published in 2016 that showed only 4% met all 8 health behavior guidelines. So very, very few adolescents meeting all the healthy behavior guidelines, and over 10% by age 16 had greater than 5 health risks. That's amazing. And that's at 16. So we know, or we can speculate, that at 17 and 18 and so on, it would have gotten worse. But 10% having over 5 health risks. So the study also showed that not eating fruits and vegetables, not eating breakfast, being overweight or obese, physically inactive, smoking, all predicted other health risk behaviors. In other words, it shows that these health risk behaviors are interrelated, and we really need to teach our youth about this, no matter where we work or how we work with youth, or whether we have young people in our homes. So this was a great study, and the focus was the conclusion was prevention targeting multiple health risks is absolutely critically needed. So let's take a look at some of our own data. By our own data, I mean, I ran this for you, looking at and using the CDC's Youth Risk Behavior Survey data analysis tool. You could look it up online yourself. You could use this tool yourself, and you could run crosstabs yourself. Most recent data, 2019, all US high school students. So I didn't look at particular states, but I looked at all across the whole United States, high school students. And then you can look at this by middle school. You can look at different states. A great, great tool. That's the CDC Youth Risk Behavior Analysis tool. So what we're going to do is I'm going to show you the results of the analyses I ran. Adolescent sports and health behaviors by substance use, in particular two measures: ever using cigarettes and current alcohol use. Now, this is a complicated area, and I'll explain it a little bit more, but let's take a look at some of the results. So sports and health behaviors by substance use, and the two measures are ever smoking, and that's what we'll start with here. So here's the relationship, a crosstab of playing on a sports team, playing at least one sports team. I think that was in the last year, by ever smoking cigarettes. And to the right here, you can see the chi-square test, P, that's the probability value is very, very small, that it's anything but a real finding. It's the chances of it being just by chance is 0.0005. So very great likelihood that this is a real association, a real relationship. And if you look at the far left, you can see that under yes sports, 22% saying that were in sports said that they ever smoked. And if you look to the right, those who didn't get sports, about 26, almost 27% said they smoked. So you can see sports team associated with less smoking, ever smoking, than if they were never on a team. So we can see that a protective effect, if you will, being on a sports team and preventing ever smoking cigarettes. The same relationship we could see with eating breakfast. Those that ate breakfast every day, 18% smoked. Those who didn't eat breakfast, 26% smoked. These are all significant, highly significant associations. So playing on a sports team, eating breakfast, and getting 8 or more hours of sleep every night was associated with less ever smoking. 18% that got sleep every night, 8 hours of sleep, reported smoking. Almost 26% who didn't get sleep reported smoking. So that's the association between sports and breakfast and sleep. And now let's take a look at the relationships with current alcohol use. So you can see here sort of a shocking relationship or association, if you ask me, but certainly supported by a growing amount of research, which showed that if young people, if they played on a sports team, they were more likely to be drinking alcohol. 32% on a sports team reported currently drinking alcohol. 26 not on a sports team reported drinking alcohol. So more kids on a sports team currently drink alcohol than not on a sports team. Again, the healthy relationships among breakfast show that if you eat breakfast, less likely to drink alcohol currently. If you get 8 or more hours of sleep, less likely to currently drink alcohol. So what can we conclude from this sort of mixed bag of findings? And these are likely real associations. So here's 2 implications. Number 1, I think prevention and health specialists of all kinds, any kind that work with youth, as well as coaches, as well as parents, should really promote sports, physical activity, I should say sports, because that's what we looked at, nutrition, but particularly eating breakfast and sleep, so that would help prevent the onset of tobacco use, okay? So promoting sports, breakfast, sleep, very important to preventing the onset of tobacco use. On the other hand, alcohol use prevention really needs to be integrated with team sports, youth team sports, because we see that this association it indicates that team sports is linked to greater likelihood of currently drinking alcohol. Now, that is supported by a whole range of studies. Okay, so we see sort of a mixed a bag of results with regard to protection, particularly in the sports arena. So and I'll just summarize it for you very briefly from my read of the most recent research, and research continues to be conducted in this area, that sports is associated with preventing some substance use, particularly, as you saw here, tobacco use, illicit drug use, and perhaps marijuana, although the jury's not on that yet, and sports is associated with greater use of alcohol use. We know that baseball is associated with greater use of dipping and chewing tobacco, and there seems to be a link between sports teams and greater e-cigarette use as well. So we see a little bit mixed bag with regard to the sports. This implication there is that we need to, as health providers, as prevention specialists, we need to promote moving body, because we know less than a quarter of adolescents are getting physical activity. But some sports, particularly team sports, may increase the risk of some substance use. Dipping and chewing tobacco is associated with, again, baseball. Maybe team sports are associated with increasing alcohol. Team sports may be associated with increasing e-cigarette use. So the point is, we really need to have, while we promote sports, we need to also have integrated within team sports, especially prevention messages, especially we see this in the alcohol arena. So prevention, alcohol prevention needs to be provided by our coaches and within our team sports, or by prevention specialists. Now, let's take a look at further relationships between sports and health behaviors and mental health. So we're moving away now from substance use, now looking at mental health. We know mental health is critical to youth. We know COVID has worsened mental health among young people in the country and across the world. So we're going to look at two indicators of mental health that are found on the Youth Risk Behavior Survey, and that is feeling sad or hopeless. This is really a critical measure, because we're not just talking about, nothing here. We're talking about feeling sad or hopeless such that it interfered with your daily activities. And then the second measure of mental health was seriously considering suicide. So let's look at the results. We see that playing on a sports team, at least one team of sports, is a protective factor. Those individuals, those kids on playing sports, are less likely to feel sad or hopeless than those not on the team sports. You can see 32% compared to 43%. So that's a plus. Team sports protective against feeling sad or hopeless. 60 minutes of physical activity, same kind of relationship. That's physical activity at least 5 days a week. So we see that physical activity, being physically active, less likely, those individuals less likely to feel sad or hopeless, 30% compared to 42%. Again, we see eating breakfast protective against, in this case, mental health. Those who eat breakfast, 25% feel sad or hopeless. 42, almost 43% who don't eat a breakfast every day feel sad or hopeless. So quite a strong relationship there with breakfast. And sleep, also quite a strong relationship in favor of preventing, if you will, feeling sad or hopeless. So that's sad or hopeless. Now let's take a look at the relationship between sports, physical activity, and healthy behaviors, and seriously considering suicide. Same kind of a relationship. Kids that are on a sports team, one or more sports teams a year, less likely to seriously consider suicide. Kids getting 60 minutes of physical activity 5 days a week or more, less likely to seriously consider suicide. Kids that are eating breakfast every day, less likely to seriously consider suicide than those not eating breakfast. And those who are getting sleep, less likely to seriously consider suicide than those not getting 8 or more hours of sleep. So what can we conclude? I think really important implication here is that sports participation, physical activity, nutrition measured in breakfast consumption, and sleep should be promoted by prevention and health specialists, coaches, parents, everybody who works with young people, so that these behaviors may improve mental health measures. 2 critical mental health measures: reducing feeling sad and hopeless, and reducing seriously considering suicide. So these health behaviors, sports participation, physical activity, breakfast, sleep, very, very important to mental health. Now let's take a look at these behaviors in relation to physical health. And what we're going to look at here are measures of obesity, which is a good measure of physical health, and fruit and vegetable consumption, which is an indirect measure of health by looking a little bit more closely at the nutritional consumption. So playing on a sports team, less likely to be obese, 12% compared to 19%. Playing on a sports team, greater association with vegetables, and particularly the measure here was vegetables 3 or more times a day. So I didn't just choose whether they ate vegetables or not. I chose the highest level of vegetable consumption and the Youth Risk Behavior Survey, and that was 3 or more times a day. And you could see kids that played on sports were more likely to have 3 or more vegetables a day, 16%, versus those who don't play sports, 11%. We also saw a positive relationship between playing sports and eating fruit 2 or more times a day. That was the greatest measure of fruit consumption. Those playing sports, 33% ate 2 or more fruits a day. Those who didn't play in a sports team, 23% ate fruits, 2 or more fruits a day. So strong relationship between playing sports and fruit and vegetable consumption, and a negative association with obesity. And the same thing with 60 minutes of physical activity. We see those who are physically active, less obesity. Those who are physically active, more consumption of vegetables, particularly 3 or more a day. And 60 minutes of physical activity associated with, those kids are associated with eating 2 or more fruits a day. So concluding, sports participation and physical activity should be promoted by whoever works with young people, and by parents included, coaches and teachers, etc., for reducing obesity and increasing fruit and vegetable consumption. Remember back the early slide I showed you, 42% of high school adolescents are eating less than 1 fruit or vegetable a day. So really important to promote these physical activity and sports. That's likely to increase fruit and vegetable consumption and reduce obesity, which is an epidemic in our country. It's actually a pandemic across the world, obesity among young people. All right, let's take a look more specifically at research and evidence-based information regarding the benefits of youth sports and physical activity. This data is from the, as you can see there, President's Council on Sports, Fitness, and Nutrition, their science board a couple of years ago, 2020. And this is largely looking at the benefits of sports research, but you could broaden it. If it, chances are, if the effects are associated with sports, it's physical activity in general as well. So mental, emotional, and social benefits. So we talk a lot about the need for social, emotional education. Well, guess what? Sports has a lot of mental, emotional, and social benefits. And here's the list of them. These are all associated with a number of studies. And by the way, there's the link to this document, so you'll be able to see the references, the studies that are cited. and the sources that are cited. So what are some of the benefits of youth sports with regard to the mental, emotional, and social benefits? You can see a long list there: lower rates of anxiety and depression, lower amounts of stress, higher self-esteem, reduced risk of suicide. We saw that in our analysis earlier. Less substance use. We saw that, although again, some mixed findings with regard to substance use. Increased cognitive performance and creativity, psychological and emotional well-being, and increased life satisfaction. But not just there. Let's take a look at sports participation in physical health benefits. Again, this is from that document you saw the link earlier, the President's Council Science Board. Improved bone health, weight status, cardiorespiratory, muscle fitness, cancer, and reduced cancer and diabetes, physical health, cardiovascular, and on and on. So really good physical data. We know more, most of us are probably more familiar and understand the physical, but I thought that this mental, emotional, and social benefits were amazing for youth sports participation. But it doesn't end there. There's educational and career benefits to participating in sports for young people: improved teamwork, social skills, social response, improved life skills. And you can see that some of them: goal setting, time management, empathy. We hear a lot about the need for empathy in today's world, work ethic, negotiation, increased empowerment, personal responsibility, self-control, which is so desperately needed among young people, improved educational, occupational skills, higher levels of academic achievement, and high school athletes more likely to attend and complete college than those not playing sports. Lifelong participation benefits from sports, you can see some of them here, can lead to improved mental health. Half of the adults who participate in sports believe that it has improved their stress and mental health. Adolescents who play sports are 8 times more likely to be physically active later on at age 24. And so really good long-term benefits of, and even economic benefits. Look at this: decrease in direct, indirect, and personal health care costs, savings of $28 billion a year if youth participate in sports, and a stronger long-term labor market. So that's sports and physical activity. What does research show regarding the benefits of healthy eating? There's 2 sources here: CDC Healthy Schools and the Academy of Nutrition and Dietetics 2021. And this is CDC data. Healthy eating among young people is associated with achieving and maintaining a healthy body weight. We looked at the data there with regard to obesity. Consume important nutrients, reduce the risk of developing health conditions. And look at the health conditions: high blood pressure, heart disease, diabetes, cancer, etc. So protective effects physically of healthy nutrition. And also just looking at breakfast alone, because that's what we did look at, breakfast. Let's look at breakfast alone. And this data, this breakfast data, comes from the Academy of Nutrition and Dietetics. I thought it was really good. You got energy, improved concentration, better grades, better healthy choices, and it tastes great. All great reasons to eat breakfast. So energy, for example, energy along with sleep, along with exercise, is really a good analogy, is like charging your batteries, essential to having the energy to perform throughout the day. Improving concentration, breakfast has been found to be essential to brain functioning, particularly memory and recall, and therefore that's why you would expect to see better grades among those youth that eat breakfast every day, particularly a healthy breakfast. So greater academic performance. We know that these positive behaviors, these wellness behaviors, are associated. So youth that eat breakfast are also more likely to make other positive, healthy food choices, like eating more fruits and vegetables. And we could really promote breakfast by promoting the fact that it can taste great and giving youth options and variations. It could be fruit, it could be toast, it could be low sugar cereal, it could be eggs, it could be oatmeal, on and on. Lots of choices for healthy breakfast. How about the benefits of sleep? This is from the Sleep Foundation 2021. Great benefits of sleep. Oops, sorry about that. Thinking and academic achievement. Sleep, like nutrition, like physical activity, essential to brain functioning and promotes attention, memory, and analytical thought. Really important to functioning, therefore, in school and in work. Emotional health. Most people have experienced how sleep can affect mood. And we know when our kids are not getting enough sleep, you can see that they have these exaggerated emotional reactions. And that's the last thing we need among our adolescents who are already having issues with hormones. So sleep, really important to emotional health. Physical health and development. Sleep contributes to effective functioning of almost every system of the body, almost everything. So it is truly a miracle pill, if you will. Sleep. So is breakfast. So is physical activity. Decision-making and risk behavior. Sleep helps increase better development of that frontal lobe, the part of the brain that's critical to impulse control and decision-making. And we see this in accidents. Kids that get sleep, adults that get sleep, less likely to have accidents on the job while driving, etc. So benefits of sleep, critical. Now, to sort of summarize this, the Prevention Plus Wellness, that's PPW, really has embraced this integrative and interconnected model for promoting youth wellness. So the blue ball is substance use prevention. If you include substance use messaging, preventing substance use, avoiding substance use, plus the green ball, which is promoting healthy behaviors, sports, physical activity, breakfast, nutrition, sleep, these two together is essential. You can see the arrow to the right, to improving overall mental and physical health. And by improving mental and physical health, that helps support and helps reduce substance use and improve and increase protective wellness behavior. So it's a synergistic, interrelated, integrated type of a model. But it starts with us as parents, as coaches, as teachers, as prevention specialists, as specialists in the areas of health and fitness, et cetera, that we address substance use prevention with promoting healthy behaviors. And how do I know that this is important? Because there's been multiple studies, and here's just two reviews of studies of the efficacy, of the effectiveness of addressing multiple health risks, not just one at a time, not just trying to increase physical activity or sports, not just trying to prevent cannabis use, but addressing multiple risk factors together. We see that one review, both of these were published in 2018. One in 2018, the first one showed that multiple risk behavior interventions decrease adolescent substance use. And some of these interventions were just a single time. The second review showed that universal school-based interventions that address multiple risk factors were important to preventing tobacco and alcohol and illicit drugs while improving physical activity and antisocial behavior. So great reviews of interventions showing that addressing more than one risk behavior at a time in our programming, in our interventions, can be very effective. And I say cost effective, time saving and money saving. All right, let's shift gears now and take a look at evidence-based. Are there evidence-based programs that already exist that link or integrate substance use prevention with fitness and health promotion? And the answer to that is yes. Not a lot, but there are some. And we found some of these in the Blueprints for Healthy Youth Development. Blueprints for Healthy Youth Development is one of the premier evidence-based registries, has high standards for getting listed. And let's take a look at it. So what we did was we went to and you can do this yourselves, by the way, you can go to Blueprints for Healthy Youth Development, just search on your search engine, pull it up. And what we did was we ran a search on the Blueprints registry, and we used the search terms alcohol and tobacco and illicit drugs and physical health and well-being. And two evidence-based programs were identified. the Sport Prevention Plus Wellness program, which is a program we created. And the second is ATLAS, which stands for athletes. That's number 2, athletes training and learning to avoid steroids. So there's 2 evidence-based programs that integrate substance use prevention with promoting physical activity and other healthy behaviors. But we did a second search on the Blueprints for Healthy Youth Development. And we did a little bit different search this time. We added the search terms poor diet and exercise, risk and protective factors. And we actually found five programs, but only 3 of them integrated substance use prevention in them. So that's the top 3. Sport Prevention Plus Wellness, which we already mentioned in the previous search. In Shape Prevention Plus Wellness, which is also our program, evidence-based program, which is for young adults, and Positive Action. So we're going to take a look at all 4 of these evidence-based programs on Blueprints for Healthy Youth Development that integrate substance use prevention with the promotion of sports and physical activity and healthy behaviors. Sport and In Shape Prevention Plus Wellness are programs, Positive Action, and ATLAS. So let's take a look at them individually. Here's the Sport PPW program, and there's a link. And again, I'll be sending you a PDF of these slides, and you could click on this link if you want to go to Blueprints for Healthy Youth Development, or you could just go to our website, by the way, preventionpluswellness.com, and you could read more about the Sport PPW program. But not only does sport integrate the avoidance of alcohol and other drugs, it integrates not only avoiding alcohol and other drugs, but integrates it with sports and physical activity promotion, healthy breakfast nutrition, sleep, and stress control. And this is done in a single session, one session. So that's a very, very unique, practical program, evidence-based screening and brief intervention prevention program that also promotes wellness behaviors. So that's the Sport PPW program. Can be implemented in any setting, even during a pandemic. I think much more likely to get into settings to provide a one-session program than multiple session programs. By the way, the Sport PPW program comes in a high school and a middle school and an elementary school version. The In Shape Prevention Plus Wellness program is a version of, I guess you could say, sport for young adults. It's implemented in colleges and communities. Even the U.S. Air Force is using In Shape. And again, one session program that integrates the prevention of alcohol and drugs with the promotion of different kinds of physical activity, sleep, nutrition, and stress control. Okay, both of these programs evidence-based. They're both listed on the Blueprints for Healthy Youth Development, and they have a number of studies which are shown to be effective in preventing alcohol, marijuana, other substances, and promoting physical activity and other wellness behaviors. The Positive Action program is not our program. It's school-based social emotional learning. Some of you might be very interested in this. There's an elementary school version, a middle school version. And but it's quite a commitment because it's 140 15-minute lessons per grade, K through 6, and 85 15 to 20-minute lessons for grades 7 and 8. So it's a school-based program. That's Positive Action. There's a link if you want to learn more about that social emotional learning program that integrates substance use prevention with promoting health and fitness behaviors. And then here's this ATLAS program I was talking to you about earlier. That's athletes training and learning to avoid steroids. Again, this is the 4th evidence-based program. And this is a specific program particularly for, by the way, there's a version for males and females, but the male version, ATLAS, is on the Blueprints for Healthy Youth Development. And the idea here is to promote healthy behaviors like sports participation and nutrition, et cetera, while avoiding steroids and other substances. And you can see ATLAS is a 7-session classroom curriculum and a 7-session weight room skill training session. So it's really for those kinds of team sports, particularly those that use weights. for body strength. Now, lastly, let's take a look at the three-step prevention plus wellness model. It's an evidence-based model that all of you can use, teachers, coaches, parents, to create your own messages, your own strategies that integrate, hey, avoiding substance use is essential while promoting sports, physical activity, breakfast, etc., essential. So how do you do that? Well, it starts with this three-step evidence-based model. SBI is screening and brief intervention. PPW is prevention plus wellness. 3 steps. The first step is you assess youth for their current health habits. That's not for you, it's for your youth to think about their own health behaviors. What are they doing with regarding to alcohol or other drugs? What are they doing with regard to sports or physical activity, breakfast, fruits and vegetable consumption, sleep, etc.? Secondly, you provide feedback on each of those health behaviors, alcohol, but also even as essentially, you're going to provide feedback on breakfast, on nutrition, on physical activity and sports, etc. And you're going to use positive image communication, which is going to not only be effective by increasing unconscious images that young people have of themselves being more fit and active and healthy and successful, that increased motivation for change. And so that is so, but they'll be likely to listen to you because it's positive messaging. And then how you link alcohol or other drugs, marijuana, cigarettes, e-cigarettes as being harmful to those healthy behaviors and benefits and images. And then lastly, you're going to help youth take initiation to change and improve their lifestyles or continue a healthy lifestyle by setting goals, not just to avoid substance use, but to increase one or more healthy behaviors. It could be sports participation or physical activity, eating breakfast, eating fruits and vegetables, getting more sleep, controlling stress, a lot of things that youth can set goals for. So that's the 3-step process for the prevention plus wellness model. Let me go over it with you very quickly. Step 1, you want to screen youth through the current health habits. Here's some examples of some questions for health habits. What sports or physical activities did you play in the last year? Do you play sports or physical activities regularly, like number 2, 30 minutes 4 or 5 times a week? Number 3, do you usually eat a healthy breakfast? For example, whole wheat toast, oatmeal, eggs, yogurt. Number 4, do you usually get 8 or more hours of sleep? Number 5, do you usually practice stress control techniques? Number 6, have you ever had any alcohol or any marijuana or any e-cigarettes or any opioids, etc.? So these are some of the questions you could ask. You ask these questions and you're not interested, it's not for your benefit. You're not going to be collecting this information from your youth. You're asking them so that they're aware of their health habits. Okay, so you're not collecting this data from them. You're just asking them to answer these questions to themselves. That increases their awareness of a broad range of health behaviors. Now, that's step 1. Step 2 is now you're going to provide this positive image integrated messaging. And it's integrated because it's 2 steps. Positive message about the wellness behaviors, integrating how substance use harms those wellness behaviors. So here's the 2-step messaging. The goal is to trigger a picture, a mental picture in the mind of the youth, something very vivid, where a healthy behavior like breakfast or fruits and vegetable consumption or playing a sport is resulting in something very, very positive to them. They see themselves, they feel themselves being healthier, being more successful, being fit, being more active, etc. And so here's the 2-step messaging. Step 1 of the messages, you highlight these benefits. And so here it is, young people, there's the target age, or it could be high school students, or it could be young adults, or it could be middle school students that engage in regular exercise. And again, that could be other health behaviors, tend to feel energetic, sleep better, and look more active, fit, and confident. So the image terms are underlined for you. They evoke unconscious images. Who doesn't want to be more confident, fit, and active and successful? We all do. We want this for our youth, and they want it for themselves. Other benefits, including sleep better, that were not an image term, but still very important. And we're going to highlight these benefits associated with these wellness behaviors that we want to promote. And then we link how, in this case, marijuana use can reduce your energy needed to participate in regular exercise and prevent you from achieving your fitness goals of being in shape, of being fit, of feeling good, of looking good, of being active. And so that's the simple two-step messaging process, highlighting the benefits and images of a wellness behavior and linking how one or more substances can interfere or harm those outcomes. And so you can see on the left here, you can see images, let's say, so you can do this yourselves. Let's say you want to promote physical activity or sports. You list some benefits and images like high energy, fit, active, friendly, successful, very image oriented, very powerful, very motivational. And then on the right, you make a parallel column where you can show how alcohol or marijuana or e-cigarettes harms each of those. So in the left-hand column, physical activity results in being high energy, and the right-hand column, marijuana saps energy. In the left-hand column, physical activity makes you feel fit. In the right-hand column, it's marijuana is more likely for you to eat junk foods and therefore be less physically fit, etc. Okay, see that relationship? Let me know if you have any questions about that. Here are some examples of that visually. In our programs like Sport and In Shape and Marijuana, PPW, et cetera, we actually show images for the visual learner. So you can see on the left, you've got those terms, fit and active, fun, feel good about yourself, give you lots of energy. And you can see this is that first step of the two-step messaging. That's the benefits and the images associated with, in this case, sports and physical activities. And then that second message is how alcohol, in this case, is harmful. It doesn't mix with an active lifestyle. It can hurt how well you do in sports. It can reduce your energy level to be successful in sports and school, etc. Here's another example of looking at breakfast and nutrition. Here's the benefits and the positive outcomes and images associated with eating a healthy breakfast. There's a little instruction there. Healthy breakfast means eggs and nutritious cereal, etc. It can have really a big effect on how you feel and energy and how well you do. By the way, alcohol and marijuana can really rob your body of vitamins and minerals. So it's, marijuana and alcohol is counterproductive for those of you that want to have the benefits of a healthy diet. So that's the messaging. That's step two, the feedback, step two, and step three, you want to engage your youth in change. And the best way to do that is to get them to set a goal, not just any kind of goal, but a goal that, and these are the 6 components that we have in Prevention Plus Wellness goal setting. You want youth to pledge or identify substances to avoid. You want them to, number 2, select a wellness behavior to increase and to state that behavior in a measurable way. You want to co-sign their goals, so that increases motivation for change. To identify, have your youth identify where they're going to post their goal and monitor their goal for the next 7 days. Short-term goals, monitoring every day, and then you could, at least mention to your youth the following week to continue to set goals week after week. So goal setting, action piece, this is the self-control piece, self-regulation piece, really, really important. And here's a sample of a goal. We've got one online that you can take a look at if you'd like to look at one. So let me conclude, because we're almost out of time. Very important conclusion is, number 1, the great majority of American, and I would say Western US youth or developed countries, adolescents from developed countries experience multiple risks to the physical and mental health and well-being. That's number 1. Number 2, teachers, coaches, parents, and everybody who works with youth should really be promoting sports and physical activities and nutrition and sleep, because we could see these are really important to avoiding substance use and to improving mental and physical health of young people. And in those cases where sports may actually increase the risk for substance use, particularly alcohol, maybe e-cigarettes, we know that we should really include prevention in sports settings. We know coaches really need to include those prevention messages. Number 3, there are a few existing evidence-based programs that in a single program, you could prevent substance use and improve sports, physical activity, and healthy behaviors. And one of them is Sport PPW Program for Youth, which is our program. And number 4, you could use the 3-step evidence-based screening and brief intervention PPW model if you want, for you as a teacher, as a coach, as a parent, to create your own, to link your own positive messages that promote healthy behaviors, while at the same time linking the critical need to avoid substance use and to help your youth set goals to move in that direction to improve their overall well-being. All right, that's it. Now, you want more information from us, you can go to our website, preventionpluswellness.com. There's our phone number here in St. Augustine, 904-472-5022, and you can email us at info@preventionpluswellness.com. All right, I'm going to pause at this point and see if anybody has any questions. Let's go to the Q&A first. And we have people coming all the way from Uganda. Thank you guys for joining us. It's evening there in Uganda. Thank you for calling in. And let's see if anybody has any questions here. We had people saying hello and good morning. I'm going to back up here and make sure we didn't miss anything. Good morning and good afternoon from people, Arizona and Oregon and Delaware. Awesome, awesome. And let's see here. The last one is from James. So any questions? Does anybody have any questions, any comments, anything that they liked, that they didn't like about this session? I think it's really important that we as prevention specialists promote healthy behaviors. And those of us that are in the areas of sports or fitness or health education, that they also include the messages to prevent substance use. We need to have more holistic communication for our youth. We can't afford, we don't have the resources to address each of these risk factors separately. And we got to get out of our silos, our silo of sport or our silo of nutrition or our silo of substance use prevention, and think more holistically when we work with our youth. Every prevention specialist should be promoting sports and physical activities and breakfast, and vice versa. That's my take on it. That's my take of that. And I think you saw the research to support that. Thank you guys and I appreciate you all, and thank you for the winks, and awesome presentation. Everybody who's registered will get a PDF of the slides. You'll get a link to the recorded session, and you'll get a certificate for 1 hour CEU for joining us for this. I don't see any questions. I see a lot of thank yous, which I really, really appreciate. So I'm going to let you guys go. God bless you again for what you do. Keep up the good work. Do stay safe. Do take care of yourselves. And if there's anything we could do at Prevention Plus Wellness, let us know. We'd love to work with you and support your efforts to promote the overall physical and mental health of your youth. Thanks, everybody. Have a great day. Enjoy. And hopefully I'll see you next week for our next webinar. Bye-bye.